How many of you are familiar with MyChart? MyChart is basically a patient portal where you can either talk to physicians or you can talk to the clinics that you go to for certain things. I use MyChart when I have to talk or get information from my endocrinologist or from my ophthalmologist. Basically, that's the diabetes doctor and the eye doctor. But MyChart isn't the only one out there. There are other patient portals. For instance, I have a different one for my primary care physician where they can send me information or they can let me ask them a certain question kind of quickly. And for the most part, it works okay. Sometimes you get overburdened with a whole lot of messages coming to you saying, hey, we need you to open this up and look at it. But in essence, it's not bad. It worked earlier for me when a couple of months ago I needed to contact my primary care physician's office, basically because I was having trouble with my left leg for a couple of weeks, and they recommended that I go in to see them because it might need some testing. That was fine. The reason I'm bringing that up today is because there's a news story saying that the Cleveland Clinic, which obviously is in Cleveland, Ohio, is going to start charging people $50 every time they use MyChart to ask a medical question. And it's got kind of an uproar on one end, but it's being totally supported on another. The uproar, of course, is coming from patients who are saying, wait a minute, I'm here at home. I don't have another way to find any information. You're the physicians. You're the clinic. I just have a quick question. From the doctor's side, the physician's side, what they're saying is that, yeah, but now this is something else where we're working all day long, sometimes a double shift, and now we have to try to catch up with everything else because we can't allow the nurses to give all those answers. So sometimes we have to look at that. So now we're getting, charged against our normal pay time. We have to do something after hours. And I'm kind of mixed because part of me says that it makes no sense for me to have to, if I have a quick question like I did with my leg, do I call them up and just let them make an appointment if I wasn't sure if I really needed to go in or not? Or do I just go ahead and make the appointment, do it? Or do I want to pay $50 just to ask a quick question? I don't want to pay $50 to ask a quick question. So we'll just get that out of the way right now. But I do understand now we have fewer physicians. After the pandemic, we have fewer nurses, which means that people are stressed. Even our medical care providers are stressed, trying to keep up with all the backlog and then try to do this extra stuff. I don't really have a solution to this one. I don't know. I know that me personally, if I knew that my clinic doctors or my primary care doctor was going to charge me $50 every time I asked a question, one, I'm going to balk. I'm not going to use it. Or two, I'm going to be expecting some kind of detailed response, which is ridiculous because when I had this pain in my leg, I had already kind of done a little bit of research, so there wasn't anything more that they could have told me that I hadn't already found out. The idea about should I go in to see them, that was their call. It was a smart call. It didn't solve anything because I did another video where I talked about getting an x-ray in my first ultrasound ever, which was really embarrassing, but that's just how it is. And they didn't find anything. And then a couple of days later, I found my own solution online, where I had actually gone before, but I hadn't really looked up how to cease the pain or reduce the pain. I had looked up what this pain could mean. So on me, that's my fault. But in general terms, boy, this is a tough one. So I'm going to ask y'all, what do you think about something like this? Do you believe that if you're already paying to go see a doctor or a primary care clinic of some type, that if you have a quick question and you want to ask them through the portal that you should be charged for it? Or do you understand, yeah, when I go there, because whenever we go see the doctors, we always have to wait. Sometimes there's a whole bunch of patients waiting there. And if you have to wait until after hours to get a response, is that actually fair for the physicians or not? Or do you think, like probably a lot of people, that they get paid a whole lot of money regardless, and that we should be able to ask our question. We're not necessarily expecting an immediate answer, because if we need an immediate answer, we probably already need to go to the doctor or to the emergency room. What do you think? That's what I got today. My name's Mitch Mitchell. Y'all let me know. You take care.